If you are a second year MBBS student or you are about to enter second year, this video is going to be helpful for you. In this video, I'll be sharing the core textbooks that I'm using for my MBBS second year, that is Pathology, Pharmacology, and the last one is Microbiology. These three are the core subjects of second year. I'll help you in how these books really or actually help from an exam as well as conceptual point of view. So let's start. First, we will talk about the pathology. For this, I'm using Robbins. There are other two books also like Harsh Mohan and Ramdas Nayak, but I'm using Robbins. I'll tell you why. Robbins is considered as the gold standard in pathology. The biggest advantage of Robbins is that it gives a very strong conceptual clarity, whether it's general pathology like inflammation, neoplasia, or systemic pathology. The language is scientific but understandable. I'll show you a look. You can see. See, the diagrams or the pictures are also so well mannered. It has flow charts. It has diagrams. See, you can see the clinical correlation really help. I'll show you. See, this is how it looks like. So it comes in two volumes, volume 1 and volume 2. I'm having the 10th edition, and right now it's for, I think, in 11th edition is going on right now. So I would say Robbins is perfect if you want to build a strong foundation, especially for future clinical subjects and for exams. Coming on to the next book, that is Microbiology. This is a questionnaire. So the first book is Apurba Sastry. So about Apurba Sastry, I can say that it is extremely exam oriented. If your aim is to score well in university exams, this book is perfect. I can show you the content is well structured and the topics are explained point wise. You can see here the tables and the contents are totally exam based. It will help you to revise in a very short time. As you can see here, the diagrams are so well defined. For theory answers, Apurva Sastry fit perfect. Like, you don't have to go for any other notes. See, you can see the lab diagnoses are given in short, and further they are explained the further tables just to revise quickly before your exams. The images are so good. You can actually get a practical idea how the things look like in the microbiology labs. For pharmacology, I have KDT. KDT is one of the most student-friendly pharmacology textbooks. It explains drugs in a clear, logical sequence, and I'll show you the sequence later. So what I really like about KDT that it balances concepts and exam relevance very well. The classification tables and explanation makes the pharmacology less scary and more understandable, especially for the beginners. I'll show you with an example. See, let's take in gastrointestinal drugs. So here, what is peptic ulcer? The disease, its explanation, its regulation, and most important thing, it's the diagram related to that is given. Then the most important part for the drugs or like for the medicines that we have to learn, it's a classification. Then with that, you can see every drug is given with their pharmacokinetics, their mechanism of actions, their interactions, their adverse effect, their other uses. It given in a very nicely ordered manner. So most commonly drug that we use, or you might have heard, like omeprazole. So yeah, and you can also see that for revision they are given tables also in this. So it's very helpful in that, and end of the every chapter includes a problem directed. You can say, like, in short, it's a case study. So closing, these are the MBBS textbooks that I'm using in my second year. So you don't need to read every book to cover. What matters is using the right book in the right way. Thank you.